guys, I'm Jarek Naylor, and this is Partially Impartial. This week, we've continued to see an explosion of new cases here in the U.S. and also across the world. We've also been keeping an eye on some of the protests that have been taking place. We'll give our perspective on some of the aspects of reopening that we're seeing and a few other notable things that have been happening. That being said, it's just me and Sheldon this week, so thanks for joining me.
Yeah, happy to be here.
So I want to start off by talking a little bit about the numbers. Basically what we're seeing is just a continuation in all of the countries that have been having an explosion. They're continuing, such as US, Brazil, India. Looks like Russia. Yeah, Russia's doing about the same. Not exploding too much, but kind of just sitting at a stable coast. Spain and Italy seem to be doing quite well so far, so maybe what they're doing we could kind of use as a template for what we should probably do here in the US. Now, the biggest question is that's on everyone's mind still is what's going to happen with the death rate, because we're pretty much seeing that here in the US, but we're probably not going to be able to actually stop the virus or slow down the virus too much. Just because we're kind of putting more of the focus on the economy, which, there's some valid arguments to the fact that maybe we should be focusing on that, especially if the death rate does stay fairly low. Though I think what is most likely to happen right now is that we'll see the death rate slowly creep up. We had 850 deaths in the US 2 days ago, and that's not the lowest that we've seen. We actually got down to around 500 per day, and now just the last week was the week that we finally saw somewhat of a reversal in deaths. We're hearing from a lot of the media sources and a lot of other sources that the deaths have been continuing down, but that is no longer true as of last week that we just passed. So there's still the question of how high is that going to go now. What Raoul Pal predicted, which is a very prominent person I listen to from Real Vision Finance, he layers the graphs on top of each other, the cases graphs and the deaths graphs. And if you put a 25-day lag on the deaths and basically fast forward the death graph by 25 days, then it actually traces almost perfectly with the cases. So it hasn't been 25 days since we started seeing this huge explosion again, but we are getting closer and closer to that. So very likely the deaths are going to go up, but the big question is how much and what is our response going to be when that starts happening.
Yeah, I don't know what we're gonna do honestly if the deaths start going up, because we were talking a little bit before the podcast about how we could potentially start seeing lockdowns happen again, and I don't know how people are gonna go for that. We're already having people that are just arguing and getting all upset about their rights over wearing a mask. I don't know how people are going to take having to be locked down in their houses again if things start going south again with deaths. So,
yeah, I think we got to be pretty prepared for what that response could be, because we survived the first lockdowns. Nobody got too angry. Not too many people died, and the economy survived, even though we've taken a massive hit. But the stock market and basically every company is they're basically planning for this reopening to go smoothly as far as profits go and investments. It's becoming priced for perfection again, which really makes me wonder, because it seems very obvious that there's going to be more turbulence and that this isn't going to be a perfectly smooth opening. So it really makes me wonder why they're trying to pump up the stock market so high. Are they trying to draw in as many people as possible? And then, the real crash happens, and then reality starts to set in. We start to see insolvencies and bankruptcies. That will be yet to be seen. But I think this next month for sure is going to be very crucial from going forward from what we're actually going to see here. But one thing I wanted to talk about Sheldon actually sent me a link to this government official, and there was this guy narrating it as well. But it was very interesting for me to see what the government official said, and then compare it to all the other data that I have come across. So basically, what the video said. A reporter asked a governor, it looked like. Apparently, there was a death of a younger person, I think a teenager, and he was asking the governor, is this the first time we've seen a teenager die with the virus in that particular state? And the governor turned over the time to one of his experts, and the expert came on and described, she didn't really answer the question at all, but she described that the way they're counting deaths is basically anybody that has the virus upon their time of death is being marked as a COVID death. Which, if I was a skeptic and I heard that, then I would pretty much instantly just write off this whole virus thing as an overblown government fear tactic, And so, what doesn't add up to me is all of the excess deaths that we've seen. So if that were true, if it was true that the government was trying to basically count anyone as a COVID death as long as they had it at their time of death, then that would mean that we're not seeing more deaths than usual right now. But something I've talked about on previous shows is that we are actually seeing huge amounts of death, far even higher than what are being marked as COVID deaths. So I have an article here that kind of goes over it, even though I've talked about this on previous shows, but we'll just kind of reiterate it because I think it's really important to kind of understand this confusing way that they're marking deaths. So this article here, it says, question, did more all-cause deaths occur during the first months of the coronavirus disease pandemic in the United States compared with the same months during previous years? Findings. In this cohort study, the number of deaths due to any cause increased by approximately 122,000 from March 1st to May 30th, which is 28% higher than reported number of COVID deaths. Meaning, official tallies of deaths due to COVID-19 underestimate the full increase in deaths associated with the pandemic in many states. So basically, what they do with these death charts, they can compare them year over year and just count the total amount of people that are dying, and then compare that year by year, because that means you're not relying on testing, you're not relying on anything else, you're just strictly relying on the number of deaths. And if you look at these charts year by year, they actually are very close every year. As long as nothing comes through and increases it, the amount of people that die on a day-to-day basis or a month-to-month basis is actually really consistent if you compare, let's say, March of one year compared to March of another year. And this year, from March 1st to May 30th, we saw an increase of 122,000 above what would normally have died. And the amount of COVID deaths that were counted in that time was, I believe, around 90,000. It says right here, yeah, there were 95,235 reported deaths during that time, but yet 122,000 people died above what would have normally died. So we can for sure say that something is coming through and killing a lot more people than usual. But it really makes you wonder, why would the government be saying something that would make people believe that the deaths are overblown?
Yeah, I don't know if they're necessarily trying to say that the deaths are overblown, but I mean, it is kind of interesting that they're counting like anything, any kind of death, if you had COVID at the time, as a COVID death. So you get in a car crash, but you tested positive for COVID, then that's a COVID death. You have a heart attack, and that is the cause of your death, but you tested positive for COVID. So I don't know in that scenario if they're saying, oh, maybe COVID is the reason you had that heart attack, and so we're going to label this as a COVID death. But at the same time, it's not like they died from the effects of COVID if a heart attack was a thing. Or, you know, I don't know. I wonder why they're doing it in that way. And do they do that with other viruses? You know, like the flu or other things of that nature, like somebody with the flu, if they die of, you know, let's say same scenario, a heart attack, but they had tested positive for the flu beforehand, is it counted as a flu death? I wonder. You know, is this just the typical way our government and, you know, the medical, for lack of a better word, society has been tracking virus deaths since we can remember. You know, I mean, if I get tested positive for COVID tomorrow and they get hit by a car the next day, that's not necessarily a COVID death, but it'll be marked as one. So
at least according to what that lady says,
Yeah.
which just I'm personally not necessarily convinced that they are actually counting all of those deaths as COVID deaths just because of the excess mortality stuff. So if that were true, that they were overcounting all of these, then what else is making so much more people die than usual? So
Yeah.
I'm not 100% convinced, and obviously none of us really know exactly what's going on. We're just going off what they're saying and what sort of data we can find. But you know, it makes me wonder, why would they be telling that to people if it doesn't add up to the data? So, you know, it gets into this almost weird conspiracy type thing of like, you know, are they trying to put people's mind at ease and trying to make it sound, it's this theory I've come across in my own mind quite a bit, that I've noticed, like, so let's say the government knows that people don't trust the government and that people are really suspicious about this whole virus thing. So maybe the government is actually playing off of the other people's suspicions. So maybe because from what I've seen, the government has kind of downplayed this whole thing because they want people to go about their normal lives. They want investors to not be scared off. So maybe the government has actually noticed a trend of people distrusting the government, and they're like, well, we can actually play into that a little bit and kind of use that to our advantage to make people less afraid if we actually give them more reason to doubt the information, you know. And obviously I don't know if any of that's true, but it's kind of a interesting, you know, no other thing really makes sense about this in particular. So so basically this data shows that more people are actually dying. 28% more people are dying from COVID than is actually what is being counted. So, and you know, that you know, and later on in this article it says a lot of that has to do with the lack of testing that we first had when people were first started dying. We didn't have the testing to be able to test everyone that's dying at their house. And it seems most experts actually agree now that the deaths are undercounted based on everything. And this ties into another article here that we're seeing in Houston. And this reminds me a lot of what we were seeing in New York at the beginning. It says here, a spike in people dying at home suggests coronavirus deaths in Houston may be higher than reported. So, you know, like I said, they just don't necessarily have the resources or the desire necessarily to even test everyone, because especially in a state like Texas where they're Republican and they kind of want to downplay the virus and make it sound like they have a really good hold on the virus and that not a lot of people are dying, you know, they're probably not that incentivized to try and count every possible death. So let me go into this article here a little bit. Oh, this lady's name is Karen. I don't know if we can trust this, actually. When Karen Salazar stopped by to check on her mother on the evening of June 22nd, she found her in the worse shape than she had expected. Her mother, Felipa Medellin, 54, had been complaining about chest pains and fatigue, symptoms that she attributed to a new diabetes treatment she started days earlier. Medellin, who had seen a doctor that day, insisted she was fine, but Salazar noticed when Medellin laid down, her chest was rising and followed rapidly, as if she couldn't catch her breath. I grabbed her hand and I said, "I'm sorry, I know you don't want to go to the hospital, but I'm calling an ambulance." When Salazar was on the phone with the 911 dispatcher, her mother suddenly passed out, then she stopped breathing. Uh, with the dispatcher on speakerphone, Salazar attempted CPR, repeatedly pressing her hands down on her mother's chest, silently praying for her to startle back to life. But by the time Houston paramedics arrived at her home in northwest Houston, Medellin was dead. Days later, an autopsy revealed the primary cause was COVID-19. And, just coming from the skeptic's perspective, maybe it wasn't actually COVID-19, but they're just trying to count it as COVID-19, which isn't something that I would necessarily think would be true, but that's probably a question that a skeptic would raise. We never thought it was COVID, Salazar said. We didn't even realize she had it. Medellin's death is part of a troubling trend in Houston. As coronavirus cases surge, inundating hospitals and leading to testing shortages, a rapidly growing number of Houston area residents are dying at home. So, which is very similar to what we were seeing in New York at the beginning of this. According to an NBC News and ProPublica review of the Houston Fire Department data, an increasing number of these at-home deaths have been confirmed to be the result of COVID-19, Harris County Medical Examiner data shows. The previously unreported jump in people dying at home is the latest indicator of a mounting crisis in a region beset by one of the nation's worst and fastest growing coronavirus outbreaks. On Tuesday, a record 3,851 people were hospitalized for the coronavirus in the Houston region, exceeding normal intensive care capacity and sending some hospitals scrambling to find additional staff and space. So, this is just a little more data showing that the damage is probably higher than what is actually being reported in the deaths. And that's another thing I want to talk about is just the hospitals in general. We're starting to see quite a bit of places getting overcrowded. I know Florida is in pretty bad shape right now. I think like 56 of their hospitals are full and they're having to move people around a lot. I know some places are trying to get those emergency hospitals, those makeshift hospitals reopened, which I think, if anything, that's probably the most important data point to pay attention to, is the hospitals getting overwhelmed. That's the one thing that we have to try and avoid.
Yeah, and I think that that's the sad part that we're seeing with all this reopening right now. And though I do agree that there's some necessity in helping the economy, we're seeing a lot of industries that have been hit really hard. Entertainment industry specifically has been hit significantly, and but just the overwhelming of our medical system is. I mean, we're literally starting to see exactly like what you said, what happened in New York, starting to happen in other states. I mean, Utah, we've been placed on the list as one of the places that if you travel there, you have to quarantine yourself for 14 days. Or travel here. And it's just, it's crazy. I mean, we're seeing cases rise. Now, we haven't seen deaths increase as rapidly, but we did see a higher uptick in deaths over this last week than we have in the last 4 weeks, which, as we talked about some of that data earlier, is kind of a small indicator that this is not going away right now, and the things that we're doing aren't necessarily helping. And I don't know. We have again, kind of back to what I said earlier. So many people arguing about wearing a mask and whatnot. It's really tough. I mean, I would hope that people would choose to try and do what's best to help everybody stay safe and healthy, and our economy to stay open. But I mean, the whole purpose of the lockdown wasn't necessarily that the government didn't want people to spread the virus rampantly, is that we didn't want to overwhelm our health system. And that's exactly what's happening right now in a lot of states. And what happened in New York? The health system was overwhelmed, and like, I know people that were here from Utah that went out to volunteer to help because they needed it. And we already have doctor shortages across the nation in different specialties just because of the high level of difficulty it is to become a doctor in the first place. That we're going to put such a stress on our medical system that things are going to um, you know collapse in a way, or just be overstressed, and uh, people are going to die at home, and people are not going to get the treatment that they need to be able to survive. Um, but on the flip side, there's people that have survived it and now owe hundreds of thousands of dollars to the medical industry, who's now profiting off of people who survived. It's a huge catch-22 in that regard. But I don't know. I kind of digress, I guess, a little bit here. But yeah, it's I don't know. I wish people would take more thought into the stress that we're putting on our medical system when they put a mask on. Like, and it's not necessarily, oh, I'm protecting myself, and oh, I'm protecting you, but I'm protecting medical officials too. I'm protecting the community as a whole by trying to be, you know, safe with the way that I interact with others.
Yeah, it's definitely a sign of respect toward the medical staff and personnel, which, if you put yourself in their shoes right now, they're probably getting just pretty tired. I'm sure it's probably a different experience for each staff member, each doctor, each nurse probably had a different overall experience with the whole COVID thing. But man, there's probably some people who have kind of been placed in the most active regions as they become active, and they're kind of moving across the country and going where they're needed. And some of those people are probably just exhausted, probably basically just working around the clock, taking whatever little breaks they can, and they're just working and working. And nobody sees an end to this right now. Which kind of brings me to a different topic, which is on a video that Chris Martenson recently did about just the whole herd immunity idea in general, and about whether or not you can catch it again. And we're actually starting to see certain cases where people are catching a second time already. So that would suggest that, at least in some cases, the immunity only lasts a few months, possibly even a few weeks. And that really makes you wonder how exactly this whole thing is going to come to an end, if at all. I mean, I think we're going to find a solution to this at some point, but we could just be getting ravaged by this thing for years and years. If you don't build up an immunity to it, that means basically all the population is vulnerable to it all the time. So, which kind of makes me wonder, maybe this was some sort of weapon. It just seems so perfectly designed to disrupt the system as it stands.
Yeah, I kind of like maybe more of a discussion piece, but like, do you think that it's possible that that people are catching it again because somehow the virus is slightly mutating in a way that it's different the next time that you catch it, but not different enough that the symptoms are different, if that makes sense?
Yeah, that was something that Chris Martenson talked about. He had a whole section about the video that was like kind of questions we don't know the answer to yet. And one of them was, because we have gotten confirmation of this D614G mutation, which has occurred, and that's been discovered in many places across the world. So that's confirmed that mutation has happened in some places. I believe it was something like 60 or 70% of the viruses they're finding now do have the mutation, and the mutation does make it more contagious. It's because something to do with the shape of it, it now has more spikes, or it has a more particular spike on it that can latch on to the other cells better than it could before. And so it is for sure more contagious. It doesn't seem to be more deadly at all. I know with these mutations, a lot of the times they mutate to a less deadly strain because from the virus perspective, it's just trying to replicate. And if it kills the host too fast, then that means it's going to have less of a chance to replicate. So what these viruses tend to do is mutate towards a less and less deadly version of themselves where the hosts actually survive more so that way they can pass it on more. But yes, that's something we don't know exactly if people are catching it a second time because they're getting the second strain rather than the first strain, or if it's just because the antibodies just don't persist very long, they just disappear after a while, which we do have evidence showing that that is the case. They did a study in Spain where, because one of the biggest questions right now is how many people have actually had this thing? How close are we to herd immunity? Because if you know how many people had it, then that answers the question of how deadly it actually is. Is it 50 times more people have been catching it than you realize, then it shrinks the death rate and makes it so it's not nearly a huge a threat as we first thought. But what they discovered in Spain is that an average of 5% of the population had the antibodies. So that either means, one, that it hasn't really spread to that many people, which would mean it is quite deadly, or two, it has spread to a lot of people and the antibodies have just kind of disappeared over time. So yeah, it really makes you wonder how exactly we're going to deal with this and what all of this means for a potential vaccine.
Yeah, I don't know if I have any sort of rebuttal to that, but I agree. Yeah.
Well, we'll go ahead and move on to these other topics here. We want to talk about some of the things we're seeing with the reopenings. One of the biggest things that is a conversation point lately is what we're seeing with the schools, because I know this is a huge thing on a lot of parents' minds from two different perspectives. Because one, they want their child to be safe, or at least most parents, but also two, they want to get the kid out of their hair sometimes so they can do their job, and their life is planned around their kids going to school. So anything that interrupts that plan is going to, really change the whole family structure. So it's really important that we do get back to this normal school schedule, and also just for the kids' sake, their education's sake, their social, aspect that we need to keep balanced, and their mental health as well. So it's a huge thing, and of course, it's a very potentially dangerous thing as well, because on one side they'll argue kids are pretty safe. We haven't seen a lot of deaths from the kids, even though we haven't really seen too many just the kids getting tested. Maybe they're catching it, but it's just flying completely under the radar. But for sure, we haven't seen a lot of kids die from it. So that's goes into the pro side, but also a big unknown is what if the kids catch it and then they bring it back to their house and spread it to their household. So if you picture kind of what we're doing right now, there's not very much points of contact that we all have with other people in our neighborhoods. You got the few people that you talk to in your neighborhood, and then for the most part, everyone else is kind of, you just rarely see them, rarely come face to face with them. At least that's what I see. But if everyone in the neighborhood is sending their kids to a meeting point 5 days a week, 8 hours a day, that basically means that web of interconnectedness is now much more connected. So it could potentially be a huge spreader.
I think one of the things to think about is that, for anybody that's a parent out there that has their kid in school, that, any kind of, bug that's going around in the school typically always comes home. I know lots of people that talk about how, there's a bug that's going around the school, and I got it, and the teacher got it, and, teachers know that, when a lot of kids are getting sick from something and not coming to school, that there's something going around, and this is a big thing. I mean, I even saw today from a friend of mine that is a teacher. She shared with me this thing about how teachers need to be starting to provide a template letter for the death of a student or the teacher, and have that ready to go if something happens. And it's scary. Like, should we be reopening schools if that's the case? Like, should we be reopening schools if we're having to prepare letters of like, oh, we're really sad to say that Miss Jensen has passed away due to COVID-19, or the student little Gary Thomas has just passed away. Like, I don't know, like it's really sad. And then on top of that, you have kids that are you know immune compromised in some way. Like, I remember growing up with plenty of kids who had asthma, or have especially during allergy season when people get allergies really bad. Think about, I mean, my son, for example, gets allergies really bad, and we have to, the doctors told us to give him Claritin daily to help him with his congestion issues. And if he were to get COVID on top of his allergies, it's almost like he had asthma and is giving COVID. It's, kids that are in that kind of realm, it's scary stuff. And, well, what do we do with those children that are in that realm of things? But then on the other half of it, kind of with my experience of seeing my mom as she's been teaching her students, is what ratio of students are actually online and learning, either because do they have the equipment, do they have enough equipment? Like, especially here in Utah, there's a lot of large families, and most families only have one computer, and which kid takes precedence in their ability to be online for school during specific times of the day? If teachers are on a Zoom call, 6-7 hours a day for school, which of the 4 or 5 kids in the home are the ones that get to have school that day and get to learn that day? How are we providing the right tools for kids to be able to get the education that they need if we do keep the schools closed? I know that that's been a huge concern for a lot of teachers, because they've lost contact with their students in that regard, because they haven't been able to get online, or even maybe the parents are just not dedicated to doing it. They're just like, well, school's out,
Mm-hmm.
I guess we don't have to learn. I mean, I was homeschooled for a year, and by my mom, and I know that there were days where we laxed a little bit more than others, but she was good and helped me to be able to learn a lot of things. Really helped me get back on track with learning math and everything. But not every parent is dedicated enough or has the drive to help their children learn in that regard. And school has been maybe almost a crutch on society for parents to be able to lean on in really educating their kids, which is not necessarily a bad thing. But if we continue on this path of what's happening with COVID, what risks are we really taking by throwing our kids right back into school in the middle of a pandemic?
Agreed. So we're using some different software here, so we're going to take a quick break and then we'll keep on going. Alright, we are back. So, I think if we do see the virus continuing the way that it's going, I wouldn't be surprised if this whole school thing just becomes a non-issue. If because we've seen the case numbers explode way above where they were before. If the deaths follow that trajectory at all, to any degree, then I think we're going to have to start seeing a lot of things just completely reversing direction. It'll kind of be like a emergency thing where we just have to do it, no questions asked, no schools. And then, another place we're seeing opening up is Disney World. And we're also seeing some other theme parks open up, like here in Utah, Lagoon is open. And, kind of just thinking about it in my head, I could see this being successful. If they could handle the line situation really good, I like on a roller coaster, all the air's moving so fast, you're very unlikely to be breathing a good portion of somebody else's breath. But then again, are they going to wipe down every single seat after every single person sits in it?
Yep.
And it sounds like Disney World just barely opened up. They've been getting a pretty good amount of scrutiny. A lot of people are really polarized about whether we should be doing it or not. This one tweet here says, "I can't say how utterly disappointed I am in Disney. They cater to families and children. At what point do they stop with money making and look at the families with children? Disney World reopens to the general public amid Florida's surge in virus cases." And Florida just barely broke their record here, which is pretty crazy because it's a Sunday, and they actually broke the national record for the amount of cases in one day. So they've broken New York's record, which, man, the deaths that could potentially come from this, we might have to do a real hard pivot, and it might be much later than what New York did. So this could, if we do have to pivot, it's probably going to drag out for a very long time. But what do you think about these parks opening?
Again, it's a catch-22. I think a lot of times, like, again, I mentioned earlier how hard the entertainment industry has been hit by this pandemic. Though I know Disney is a very well-to-do organization, I feel that they would survive and weather this storm very well with just the kind of uh, things as far as movies and TV shows they can put out. They have their streaming services. They have all these things, but opening these theme parks and stuff. But I don't know. I think if they go about it the right way, I mean, people are shopping in a store, and we're doing the best that we can there to try and keep people safe going to get the necessities. Entertainment in a way is very much a necessity for human life. Like, we need it. It helps cognitively with our ability to have variety in our lives, and that's something that we just we crave as human beings, variety. So having places open but having enough restrictions around it, like, it might be a good idea for Disneyland, if you're going to reopen, like, let's put a daily limit on tickets that you sell. Make sure that maybe there's line limits, or maybe you open up fast passes to every single ride and make it so that people have to come back at specific times to ride those rides throughout the day, because the fast passing is a great way to be able to get people around to different rides, but make people plan their trip to Disneyland to the T of what rides they're going to ride and when. Like, maybe they have to schedule out their day, and they only allow so many people on a ride or in a line at a ride at a specific time. There's different ways you could go about this creatively to make it safe. And I think it's important that if we do open these theme parks, and especially one that's as big as Disneyland, that people come from all around the world to go to this place, we have to take, I think, extreme precautions, and but drastic times call for drastic measures. And if we can take these things seriously, but also allow people to have the necessity of entertainment in their life, then I think that's good. I mean, Lagoon, like you mentioned here, is open. I've had siblings that have gone there. They require you wear a mask while you're wandering around the park. I don't know if you necessarily have to wear a mask while you're on the roller coaster. I don't know if the mask would stay on when you're on the roller coaster. A lot of people lose their hats. I think maybe lose your mask too. But yeah, I think that it's good, but again, it's a catch-22, and there's going to be people that are going to be upset about it. There's going to be people who are going to be excited about it, and I think it's all about the mindset and the way that we take in handling it in the most healthy way that's going to be the most beneficial for everyone.
Yeah, I think as we've actually been progressing through this virus, I think people are starting to come around. You're always going to have those really stubborn people that decided early on that it's a hoax, and then now they kind of are stuck in that lane of not wanting to help in any way and kind of just want to keep denying it and calling people sheep and brainwashed and all that. But I think we are starting to see a pretty good amount of people come around. And what's kind of interesting is because bringing this to the fourth turning, one of the biggest things that happens during a fourth turning is you have a crisis that eventually brings everyone together because we have this united thing that we're all trying to fight against. And I think to a degree we're starting to see traces of that, of where we can actually relate to our fellow humans in the fact that we're all in this really difficult time where your lives potentially at stake, your livelihood, your entertainment, even your whole way of life is changed. And we're all, the more we can kind of all get together and battle this foe, then it'll not only have a positive psychological effect on our society, but also we'll be able to defeat it. And I'm starting to get to that point in my mind where you think about how life was and when it's gonna get back to normal, and it just kind of seems like this distant thing of just nobody really knows. But when we get there, it's gonna be so nice and it's gonna feel so good, and it'll kind of give you a whole refreshed perspective on life altogether, and hopefully we can kind of see things in a whole new way. Like a lot of things, you don't really respect them until they're taken away and you have to live without them, and then you can kind of learn how much you actually enjoyed having them in your life to begin with. But yeah, this whole parks thing and the school thing, I think we're approaching a lot of things as if it's like an experiment right now, which I feel like is probably the right way to do it. We'll try opening it up. We'll see how it goes. If a lot of people start dying, then we're just going to have to close it down. I don't think it's going to get out of hand to where, tons and tons of people will die. I think, Disneyland's going to keep a really close eye on it. The schools are obviously going to keep a really close eye on it. And we're just going to have to play it day by day and just go from there. Hopefully things can open in a safe way. And even though Florida is having a huge case explosion, hopefully the parks themselves can avoid taking part in that. And, like you said, people are coming from all across the world to go to these places, which I don't think they're going to be doing that right now, because I know a lot of international flights are still either shut down or slowed down dramatically. I don't know if they're allowing, especially in the U.S. here where we have such a huge explosion, I don't know if people are really trying to come here. I know certain places are not allowing us to go to their country. But yeah, it'll be interesting to see if Disney can make a profit even doing this. I know they're probably just burning through cash right now, but they're probably thinking we gotta at least open up partially just so we can get some sort of cash flow, service our debts, and just so we don't go under. Though I know Disney's probably probably has a bunch of money. They have so many avenues to where they can make money. But yeah, they're probably, and a lot of places are probably just burning through cash during these times.
Yeah, I think it's important to talk about as well. Like in this article, it does talk about how they're only going to have one of their parking lots open. I think they at Disney, I don't know, Disneyland or Disney World. I don't know which one it's talking about here.
Disney World.
Okay, so never been to that one, but I know that at Disneyland they have large parking lots, So, but that would be to some extent maybe the limit of the tickets that they're selling that day. Kind of like I talked about a little bit ago. But yeah, again, I think it's a good thing for us to move in this direction in some way, but we need to take the proper precautions.
Yeah, I agree. We just hope for the best, prepare for the worst, and take it day by day. So with that, I think we'll go ahead and close out the show. I want to thank all of our listeners for checking us out, especially if you're one of our subscribers. We really thank you guys, whoever, anyone who gives us a like or a follow. It's really helping our new channel grow. We could use all the help that you guys are willing to give us, so really grateful for that. And with that, just want to thank you, Sheldon, for talking with me again, and we'll see everyone later.